Great, great. Thanks, Tom. Angela Siefer, Director of the National Digital Inclusion Alliance, NDIA. Angela also wrote a paper on broadband adoption. Angela, what are your key recommendations?
I'm going with the theme of collaboration, because my suggestion is the recommendation that has to do with local and state governments having staff who are specifically assigned to work on digital inclusion, and to do that in collaboration with the others in the community, the providers and the libraries and the schools and the healthcare providers and the nonprofits, that if you don't have somebody to pull everyone together, how does everyone get together, right? Like, that one person is really important. And so we have examples of this happening both at the local level and for the first time, maybe at the state level. We finally have a broadband plan. The state of North Carolina has said that their recommendation is that we need to have somebody at the state level working on digital inclusion, or they called it broadband adoption. But working on that to pull folks together, and now they're figuring out how to pay for it, which is always the challenge. But stating the need is a first step, and that's very exciting.
And so, Angela, I'm going to bring you in on this too. Does that ring true to you?
Yeah, we discussed when Tom and I were talking earlier about the fact that there are lots of barriers to broadband adoption, and so having that cost piece and having health organizations recognize that that cost piece is important, and that for health providers to be able to engage their patients in preventative care or care where you need to know what is happening with someone. My father, for years, as he was declining, had a device in his home that said when it was that he was in trouble. They would take different vitals from him, and that saved his life multiple times. And so if we can do that for more people, that would be fabulous. But it means that they have to have broadband at home first. And it means they need to know how to use that service that they're being hooked up to. So it's both the digital literacy and it's the cost.
Very interesting. And thank you for sharing that personal example. That really rings true.
Mitzi, I appreciate your point on digital literacy. The focus on Lifeline and the great work that is occurring around Lifeline is super, but it's about cost, and that's not the only barrier to broadband adoption. Digital literacy is a huge barrier, and there's no federal source of funding for digital literacy. There's tiny little pockets here and there, but there's not a source that we can really point to. And so I think looking at healthcare is an important point, right? Is that an industry, and there are plenty of other industries we can look at, like banking, that benefits from having more folks who know how to use the internet? Yes. So it's not about asking them for a philanthropic donation. It's about, can this impact your bottom line? So can we form these kind of partnerships where the folks who can know how to teach digital literacy, because it's not just something that you just show somebody a computer, right? There are skills to teaching, as we all know. So having those kind of partnerships where the health provider or the bank or whoever it is actually benefiting because they formed this partnership.